The statistics are nothing short of shocking. Hundreds of thousands of toddlers taking steady doses of antipsychotic drugs, but lately more doctors appear to be prescribing antidepressants and antipsychotics to toddlers. A recent study found more than 80,000 prescriptions for Prozac were written in 2014 to children under the age of 2. Why would a doctor need to prescribe these drugs to youngsters? And more importantly, are they safe? Our good friend, Pediatrician Dr. Sears, is back to tackle a really important topic because this is scary because you do ask yourself, and a lot of people are hearing prescription medications for babies with mental health, and I'm like, no, these are toddlers, but why?
Toddlers, but they're just barely toddlers. We're talking about 2-year-olds on antipsychotic medications, and we're usually talking about a child with some sort of severe behavior problems, tantrums that are like atomic tantrums, or some sort of developmental problem like autism or something. And those are the kids, you know, a 3-year-old that is attacking the parents, hitting, yelling and screaming for 3 hours at a time, just at the slightest provocation. Or I even had a 2-year-old that her tantrums were so bad that she would claw at her face, you know, marking up her face, drawing blood, and if they were in the car on the freeway, she would wiggle out of her car seat and try to open the door and jump out.
Wow.
I mean, now that child actually grew up to later in childhood did get diagnosed with a actual psychiatric disorder, but you know that's the kind of child that we're talking.
Extreme times call for extreme measures.
Right. And I think, you know, years ago when I actually had this 2-year-old in my office, I would have never thought of trying a psychotropic drug on this child, but nowadays we're becoming a little more comfortable using it. Now I want to say we're not just handing these things out like candy. Usually these parents and families are at the end of the road. They've already tried the exhausted visits with their pediatrician and therapies multiple times a week for the child, special diets, personal counseling, marriage counseling sometimes, and by the time they get in the child psychiatrist's office, you know, they're at their end of the rope, the marriage is on the rocks, the parent could even be suicidal, and sometimes that is the last thing to try.
Wow, you know, it's interesting because a lot of times parents feel as though, you know, I don't want my kid on these medications, but from what you're saying is sometimes they really, really do need them.
Sometimes they do, and it's controversial because what we don't know is what are the long-term effects of putting a developing brain on medications that alter...
And how do we know at this stage dosing, is it really trial and error?
It is an experiment because there's really no data, there's no studies in kids that young, and you know, sometimes, you know, how does a 2-year-old tell you that they're experiencing a side effect? Headaches, insomnia, you know, nervousness, even hallucinations. A 2-year-old can't tell you they're doing that, and you know, they're just going to be more fussy, so what do you do with that? Do you think, oh, do they need more or less? And so that's a big problem.
This worries me, and I'll tell you why.
Wow.
Yeah.
It's not that there aren't appropriate uses. What scares me is something we've seen happen with adults, which is an unprecedented number of adults are on psychotropic medications. A lot of us disagree with how many are being prescribed. In fact, a lot of times it's just as simple as, oh, okay, let's just prescribe a medicine, and we're losing a lot of these other modalities. I worry if this becomes too common and easy that you're going to see practitioners who don't really know how to prescribe these medications doing so, parents having certain expectations, and then if kids go down the same rabbit hole a lot of adults have, which is, again, prescribing over a lot of the other therapies, this could be a bad thing, right?
Yeah, it's just a trend that I certainly don't like, and most doctors don't, because how do you put the child on that, then how do you ever get them off of it?
Exactly.
Because, you know, and that's a big problem.
Well, I'll tell you this, I obviously don't have a lot of recollections of when I was 2 years of age, but I was apparently a bit of a hellion, you know, just a strong-willed kid.
Well, things make sense, I guess.
Well, and my point is that it's such a fine line between kids being kids and what we call abnormal behavior. And I'd say as long we got to err on the side of as few medications as possible.
Right, sure.
Because Prozac, they're saying Prozac for babies. Really, this is, you know, this is utilizing this entire different class of medications for toddlers.
You know, I think it's important for parents, if you're considering this, make sure you're getting the proper help. Get your resources. Most areas have what's called a regional center, where you can go and you get evaluated by therapists, psychologists, and then they can set up all the different therapies that are usually plenty effective without the need for medications.